Knock, knock, knock. Hello, my name's Tiana. I'm going to be your nursing student today. I'm going to pull the curtain to provide for privacy. Can you tell me your name and date of birth?
Will Burnley, 10203.
I'm performing hand hygiene. Do you have any known allergies?
Nope.
Awesome. I'm checking your wristband, ensuring all that information is correct. I'm looking at your provider's orders here. Your provider has ordered a head-to-toe assessment, and with that, I'm going to be asking you a few questions, having you do a few tests, and then moving your muscles and your joints. And I'm going to be checking your cardiovascular and your systems from head to toe. Do you have any questions about that?
No.
Do you have any concerns before we begin?
No.
No. And I do not need PPE for this assessment today. Do you have no concerns? Are you in a comfortable position?
Yep.
Okay. Do you need anything before we begin? Do you need to go to the bathroom, toileting?
No.
That's the same thing. Do you need dentures, hearing aids, or glasses?
Nope.
Awesome. Are you able to walk?
Yep.
Do you use any assistive devices?
Nope.
And then, do you have anything that hinders you from performing your activities of daily living?
Nope.
And if you have any chest pain or shortness of breath recently?
Nope.
Awesome. I'm gonna have you come over. Just wait. I'm gonna inspect your demeanor and affect, as well as your hygiene. You have good posture as well. You're compliant. You're not aggravated. You seem willing to be here. You're dressed appropriately for the weather. You have good hygiene, and there's no foul odors, and you're not agitated by my questions. I'm gonna ask you your name. Can you tell me where we are?
Southwest Tech.
Can you tell me why you're here?
School.
And then can you tell me the date?
November 7th.
Awesome. Perfect. So he's gonna learn oriented times 4. I'm gonna have you follow me over here. We're gonna get your temperature. Let's stick this under your tongue. Let's try him. 93.8. Good. You can lift it back down. Perform hand hygiene again. Okay, so I have that. I'm gonna get your pulse and respirations. I'm gonna take your pulse first. I got your pulse as 72. Okay. And then your respirations were 14, so that's good. I'm gonna obtain your blood pressure now. And then before I begin, the blood pressure scale, or your hypertension scale. Normal blood pressure is less than 120 systolic and less than 80 diastolic. Elevated would be 120 to 129 and less systolic and less than 80 diastolic. Stage 1 is 130 to 139, and then 90 or 80 to 89. Stage 2 is 140 above and greater than 90 diastolic and greater than 140 systolic, and then a hypertensive crisis would be systolic of greater than 180 and your diastolic of greater than 120. And this blood pressure cuff is a little small for the size of this arm. (118/70), and that's normal blood pressure, which is good. Sorry. I'm gonna have you take off your shoes for me. I'm gonna inspect your skin now. I'm looking for any lesions, rashes, abnormal colors, scars, and you have good color in your arms appropriate to ethnicity, as well as your face and your legs. And then I'm gonna palpate for bilateral warm temperature, and then can I take off your socks?
Yep.
Okay. Just gonna look at your fingernails and toenails are appropriately sized and shaped. They're not abnormal by any means. An appropriate color. You have good capillary refill of less than 3 seconds, which is good, and your feet are warm and good. Awesome. No abnormal signs, and I don't see any edema. And then the edema scale is no edema or normal would be no pitting, and the indentation rebounds immediately. Stage or grade 1 would be 2 millimeters, and then that also rebounds immediately. Grade 3 is 6 millimeters, and then 15 seconds or less, and then 4 is 8 millimeters, and then that's less than a minute. And then grade 5 would be 8 millimeters. 8 millimeters. I messed that up somewhere. 8 millimeters, I believe, and then it rebounds in less than 5 minutes. And you don't have any signs of that on your arms or anything, which is good. So I did that. I'm gonna perform hand hygiene because I touched your feet, and I'm gonna start on your head and neck. So your head's appropriately sized to the rest of your body. Good color. There's no like deformations or anything. Your ears are equal and sit equally, and your shoulder, your neck is appropriately sized to the rest of your body, and it's midline. Your facial features are symmetric. Your head's symmetric, and I'm gonna have you smile for me, and then your expressions are equal, symmetric. I'll have you raise your eyebrows. Awesome. And then I'm gonna just inspect the back of your head. I'm gonna palpate your head now for any masses. Does this hurt at all?
Nope.
No tenderness. And then I would be looking for dry skin as well as infestations of lice, which is good. And then that's good. I've got your face is symmetric. And then I'm going to move on to your eyes, I believe. So I'm going to use my pen light here. I'm looking at your eyes. Your irises are appropriate color and appropriate shape. They're symmetrical and even. Your pupils are equal, round, and I'm gonna do reactive to light, maybe. And you just look forward towards me. Good. reactive to light, and I'm gonna have you follow this. Good. Good combination. Can you tell me those 4 letters?
CAVN.
Good reading, and I'm gonna have you hold your head in place and follow this. Awesome. Good. I'm gonna have you close your eyes now. I'm looking at your eyelids for any swelling, edema, drooping, or lesions. There's nothing, and I'm gonna palpate those as well. Hands here. No swelling. Does that, your globes hurt at all?
Nope.
Awesome. And then I'm gonna have you close your eyes again and go back to your face. I'm gonna place my finger on 4 points of your face, and I'm gonna have you tell me now when you feel my sensation.
No. 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 No.
Appropriately, great, awesome, thank you. You can open your eyes. So back to your eyes. Pupils are good, irises are good. I'm gonna look at your sclera. I'll have you look this way. They're appropriate color. There's no lesions. A few blood vessels, which is normal, but there's no signs of jaundice. Look at that one, same thing. And then looking at the shape of your eye. Shape of your eye here, which is appropriate, and there's no surface deviations of like scratches or lesions on your lens, which is good. And you read this, you followed it. I think that is good. Do you have any questions so far?
Nope.
Awesome. Okay, now I'm gonna do your nose. So your nose looks midline, there's no deviations. I'm going to palpate it now. There's no masses or bumps. Is this tender at all?
Nope.
No? Okay, and then I'm gonna palpate your sinuses. This is your frontal sinuses, and this would be your maxillary. Is that sore at all?
Nope.
Good. And then, so there's no deformities, it's appropriate. I don't see any discharge, bleeding on the outside of your nose, or skin issues. And I'm gonna look in your nose. Can I have you go like this? Awesome. There's no deviations, polyps, bleeding, foreign bodies, or any issue like redness or swelling, which is good. Okay, I'm gonna have you close your eyes and let me know. Close your eyes and then close one nostril. Then let me know when you smell this.
No.
Okay. We're gonna do the other side. Let me know.
No.
Awesome. Good. So that is all for your nose. Do you have any questions?
Nope.
I'm gonna move on to your mouth. The outside of your mouth, your skin is intact. It's symmetrical. And then your lips are a little dry but appropriate color. Just a few cracks. No big deal. They're intact, symmetrical. I'm gonna have you open your mouth. I'm gonna have you pull your mucus or your cheek over. I'm looking at your buccal mucosa, and it's pink and moist. That's what you want to see, and there's no lesions. I'm gonna have you pull down for your gums. They look good. No bleeding, retraction, or lesions, and they're appropriately colored and moisture. And I'm gonna have you do the same thing with your top lip. Same thing, no lesions, no retraction, appropriate color and moisture. And then I'm gonna have you stick out your tongue. Your tongue is midline. I'm gonna have you say light, tight, and dynamite.
Light, tight, dynamite.
Your tongue's midline, appropriately colored. It's not swollen. Appropriately colored. The bumps on there are appropriate, and then it's midline. And then I'm gonna have you say ah. Looking at your uvula when you do that, and it stays midline, which is good. Your tonsils are present, not swollen, and I don't see any exudate. And then I'm looking at your palate, the top of your mouth. If I were to palpate this, I would use a gloved finger and palpate your soft and hard palate. And then I'm gonna look at the bottom of your mouth, the floor, no lesions, appropriate color, and no swelling or bleeding, which is good. And then if I were to test your gag reflex, I would use a tongue depressor, a clean tongue depressor, and press it to the back of your tongue to check intactness. Do you have any questions?
Nope.
Okay, I'm gonna look at your ears. So your ears, like I said, are symmetrical. There's no external abnormalities. Your skin's appropriate, no redness, swelling, bleeding, drainage, or foreign bodies, or excess cerumen. And then your skin behind your ears is also good. Same thing over here, which is good. I'm gonna have you follow me once again over to the otoscope. Okay, for adult, I'm going to, oops. For an adult, I would pull the ear up and back, and for an infant or neonate less than 2, I'd pull their ear down and back. Thank you. Okay, your tympanic membrane is visible. It's appropriately colored, pearlescently gray. There's no swelling of your ear, and I don't see any excess cerumen here at all, and no bleeding or other issues in your ear. Same thing, your tympanic membrane is pearlescently gray. There's no abnormalities of bleeding, foreign bodies, excess cerumen, or swelling or redness. So that's good. Thank you. So that was your ear. I'm going to do your gross hearing. So I'm going to whisper 3 words behind you, and I'm going to have you repeat that back to me. Can you do that?
Yep.
Awesome.
1, 2, 3. A, B, C.
Awesome. Thank you. So now, I'm done your eyes, ears, mouth. I'm going to go onto your neck. Like I said, your neck is appropriate size to the rest of your body, and it's symmetrical. I don't see, can I have you turn your head? I don't see any jugular vein distension. Have you turn that way, which is good. I'm going to palpate your carotid arteries one at a time. You let me know. Good. Also good. I have a good strong pulse, probably 2+. And then I'm going to listen with my bell, my stethoscope, to your carotid arteries here, just for any breweries. You hold your breath for me. Good. Ready? I'll have you take a deep breath. Go ahead. Good. Awesome. So, no jugular vein distension. Your trachea is midline. No masses or tenderness. Upon palpation, I'm going to feel your lymph nodes now. I'm going to start with your pre-auricular. And you let me know if this hurts at all. I'm looking for size, or if I can feel them at all, it'll be abnormal. Post-auricular, occipital, tonsillary here, submandibular, and then submental. I'm going to do anterior superficial cervical. I'm going to do your posterior cervical, then your deep cervical. I'm going to have you turn that way. Get the in between your muscle there. Awesome. That way. Thank you. And then supraclavicular here. Awesome. No issues at all. Do you have any questions?
Nope.
No? Okay. I'm going to have you take off your shirt for me, and I'm going to do your cardiovascular. Okay, so I'm looking at your precordium, inspecting it. There's no heaves, lifts, deformities, or scars. And then I'm going to palpate it. My hands are clean. I'm not feeling any masses, bumps, excess heaves, or lifts, which is good. Awesome. Good. And then I'm going to listen to your different pulse points with the bell of my the diaphragm of my stethoscope. I'm going to start with the aortic. Over to your pulmonic. This is where I hear the S2 most clearly. And I'm moving down to the Erb's point. And then your tricuspid. And then your mitral, or your point of maximum impulse. I'm going to listen to this for a minute. Okay, I got 81, which is an appropriate sound. And then at your mitral and tricuspid is where I heard your S1 most clearly, and there's no advantageous sounds at all. So that is good. I'm gonna palpate your peripheral pulses and verbalize their strength. So I'm gonna start with your temporal. 2 plus, strong. And then we're gonna do, I'm gonna do your brachial. 2 plus there. And your radial. 2 plus. And then your femorals in between your suprapubic crest and your anterior iliac spine. I'm verbalizing that and not doing it. I'm gonna move on to your popliteal, which is behind your knees. 2 plus. And then I'm gonna do your posterior tibialis. And that is 2 plus. And then I'm gonna do your dorsus medius here. 2 plus there. And then can you feel my hands?
Yep.
And you feel them here, you have good warmth. Yep. And then I'm gonna have you wiggle your toes. Warmth, strength, or temperature, sensation, color, and then sensation. Temperature, color, mobility, sensation. Yep, I did. So that's 4 on your arms and legs, which is good. And I completed your cardiovascular. So now I'm gonna do your respiratory and your pulse. Okay, I'm gonna inspect your anterior, posterior, lateral ratio, and I'd say your anterior is 1, or yeah, lateral is 1 to 2, which is appropriate. And then that is good. I already counted your respirations earlier for a full minute. There was no use of accessory muscles. It wasn't labored, and they were of minimal depth. And now I'm going to listen to your different lung sounds. And then we have bronchial, vesicular, and then vesicular lung sounds. So I'm gonna do 10 in the front, 3 on each side, so 6 laterally, and then 12 in the back. Good, thank you. Awesome. No wheezing or crackles or anything, which is good. I'm gonna do your 12. I'm inspecting your back at the same time. No kyphosis, lordosis, or scoliosis. And then no abnormalities. I'm gonna quickly do, I'm gonna have you say 99 when I place my hands.
99, 99, 99.
Can you say 99 one more time?
99.
And then I'll have you take a deep breath. Okay, there was good excursion there, and with tactile firmness, there's appropriate bilateral vibration, which is good. And now I'm going to listen to my 12 breath sounds on the back. I'm going to do 3 laterally, so I'm going to jump from side to side. Ready, take a deep breath. Awesome. No lung sounds I didn't want to hear. Which is good. So no advantageous lung sounds. That was good. I already counted your respirations. I'm gonna have you do your abdominal. So I'm gonna have you lay down. Have you keep your shirt pulled up. Have you voided recently?
Yep.
Awesome. I'm gonna keep your legs up. You have regular bowel movements. Yep. Awesome. So at first I'm gonna inspect. You have good hair distribution, no striae, scars, lesions, masses, bulges. Hair distribution is good. I think I already said that. No movement or bulges. Can I have you lift your neck up a little bit? There's no herniation, which is good. And it's symmetric. So that is what I'm looking for. I inspected. Now I'm going to auscultate. In 4 quadrants, I'm looking for active bowel sounds. And I'm using my diaphragm again. Good. Normal active bowel sounds. No hyper, hypo. And I heard a little gurgling, so you must be hungry. And now I'm gonna palpate, and I'm palpating for surface characteristics, seeing if there's any tenderness to my client, surface characteristics, tenderness, masses, or bladder distension. Let me know if this hurts at all, okay?
Alright.
Or muscle resistance, I think is another one. Okay, that was good. Thank you. Good palpation, inspected, auscultated perfectly. I didn't feel anything abnormal. Now we're gonna do your range of motion. So I'm gonna watch you do a motion first, and then I'm gonna feel your joints. Feel the joint with my hands for any crepitus, and then you let me know if anything hurts at all. So first, I'm gonna have you turn your head up and down, ear to ear. I'm gonna have you do that all again. I'm gonna place my hand. Awesome. I'm gonna have you open your mouth, close it, and then mouth tape. Good. No crepitus or pain. No pain, right? You let me know. I'm gonna have you lift your shoulders up, put your your arms down, forward, forward, backward, internal extension, external rotation. I'm sorry. I'm gonna come behind you. Go ahead. Awesome. I'm gonna do your elbows now. So I'm gonna have you flex and extend. Go ahead. Awesome. Good. I'm gonna have you stand up. I'm gonna have you bend down. Stand back up. Reach back a little bit with your body. Reach back. And then twist. Washers and dryers. And then side to side. Awesome. I'm gonna palpate your lower back here. Awesome. I inspected your back earlier, your spinal alignment for kyphosis, lordosis, and scoliosis. Now I'm going to have you open your hip, close your hip. Abduction, adduction, abduction, adduction. Go ahead. Abduction, adduction, flexion, extension, rotation. Abduction, adduction, flexion, extension, rotation. I'm going to watch you do the flexion, extension, rotation again. Thank you. Rotation. Awesome. Any pain there?
Nope.
I'll have you sit back down. Now do your knees. So extend, flex. Go ahead. Then we'll do your feet. Plantar flexion, dorsiflexion, rotation, I believe. Okay, go ahead. Beautiful. That was good there. Did your knees. I'm going to do your wrists and hands now. Flexion, extension, rotation. Flexion, extension, rotation. I'm gonna have you make a fist, extend, fingers out, fingers in. So I'm gonna have you do that. Okay. Extend your fingers, sorry. We're good. Awesome. That's good. Any problems there?
Nope.
No. Any concerns?
Nope.
Awesome. Now we're gonna do your muscles. So I'm gonna watch you do the motion, and I'm gonna oppose your force. Okay. So I'm gonna have you turn your head side to side. Okay. I'm gonna push against. Good. And then for all of these, I'm looking for equal size, shape, and symmetry, and strength. And I want but he has good appropriate size, strength. I'm looking to make sure that they're bilaterally, the same strength. Okay, so you did your head. I'm gonna have you shrug your shoulders. This is a cranial nerve. Well, I'm gonna push down. Good. And then I'm gonna have you arms up. No, I lied, I believe. Yeah, I lied actually. No, I didn't. Go like this. Raise the roof. I'm gonna pose your deltoids here. Sorry. Okay, and then we're gonna do flexion and extension, and this is biceps and triceps. So pull against, push against. That was your wrist. And I'm gonna have you, same thing with your wrist, flex, extend. I believe. I'm gonna push against, flex, extend, and then squeeze my fingers for me. And then I'm gonna have you push out. And then I'm gonna have you push against my hands. Perfect. So that was wrist, hands. I'm gonna have you stand up again. So we're gonna do your hip abductors and adductors. Okay, push out, push in, this side, out, push in. Awesome. I'll have you sit down and have you extend your legs and bring them back in. So this is quadriceps. Sorry, this is hammies. So I'm gonna pose outward and pose inward. Good. So flexion extension of your ankle, dorsiflexion, plantar flexion. Awesome. Push and then push. And then I think that is all. Do you have any questions about that? No? Let me think. I think I got everything there. Otherwise, it's all right. I'm gonna test your neuromuscular or your neuro. Can you tell me a recent memory?
A recent memory.
Like, what did you eat this morning?
This morning I ate some eggs, drank some water.
Okay.
About it.
What did you have? What did you do last weekend?
Last weekend, what did I do? Oh, I watched the Pack games with my parents.
Awesome. And then what is an immediate memory you have?
Immediate memory, standing up, walking over to the thermometer.
Awesome. Perfect. Do you have any questions?
Nope.
You're not confused. You're alert and oriented. I'm gonna clean up my equipment. Make sure you don't need anything. You need to go to the bathroom before I go.
Nope.
No, I'm gonna have you do the Romberg test actually. So I'm gonna have you stand up and stand like this, eyes open, looking straight ahead for 30 seconds. Go ahead, and then a positive Romberg would indicate a balance issue. Okay, I'm gonna have you close your eyes now. Alright, now with your eyes closed, I'm gonna have you touch your pointer finger to your nose. Awesome. And I'm gonna have you walk to the wall and back. I'm just gonna observe your gait. Not shuffled, no shuffled slow steps. It's gonna be favoring one side or the other. Good. And then when you sit down, I'm gonna do your Dubinsky reflex. And then that would be a good, you don't want to see that in an adult. I asked you your questions. Do you need anything before I go?
Nope.
You're in a comfortable position.
Yep.
Your call light is within reach. Your bed is low and locked. The appropriate amount of your call rails are up. Your room is free from falls. I gather and cleanse my equipment. Perform hand hygiene. document per agency policy and report per agency policy. Document and upload everything on OneNote, and then I'd report abnormalities per agency policy. And then I'd perform hand hygiene. I think that's all.